celebrating the baby boomer lifestyle. This is Boomer Life with Sterling Fox on AM 650.
Nice to have you with us. In this episode of Boomer Life, we're talking with the folks from Integrative Naturopathic Medical Center on West Broadway in Vancouver. Doctors Larry and Alex Chan are in studio with us. The subject of the conversation so far is cancer and will be for the balance of the hour. This is really an important topic. Alex, you said Canadians we're frankly terrified by the word. We're intimidated like crazy by the disease. And whenever it comes up, it's the C word. Everybody gets really quiet. The conversation drops to nothing until somebody says, "Hey, how about those Canucks?" And it's all over. So we do need to talk about this more.
Definitely. It's a really important conversation. And not that it's, people, I think, get so quiet because it's almost there's so little power. And
Right.
so part of this conversation is about trying to empower people that there's things they can do and there's other options that they have. And that those things don't have to be mutually exclusive with sort of all the other things they hear about.
Right, and I guess the other part about it is why it's all a little scary to all of us, Dr. Larry, is because, well, we all know that anyone can get it.
Mm-hmm.
And, for any number of reasons. Let's talk about the two best known types of cancer, certainly to Canadians. It would be breast cancer and prostate cancer. Are those two, Alex, the most prevalent cancers in women and men?
Yeah, they are. I would say they're the most
Lung.
Lung is also really prevalent and it definitely has the most deaths. But as far as most sort of common gender specific, definitely breast and prostate.
Okay, now both have received a fair amount of public awareness in recent years, beginning, of course, with breast cancer, and that really has. There are certain groups in the women's movement who see the awareness generated by breast cancer and all those runs and fundraising as terrific, but there are other types of women's cancers that they feel somewhat slighted by. Are they right to feel that way, or can they not just take advantage of the awareness period?
Well, the awareness the awareness piece is really important,
Sure.
and I think that anything that's really raising that awareness about people trying to be more productive and proactive about their health is really important. But I feel like almost with breast cancer, there's almost this rah excitement
Absolutely.
that we're winning, we're succeeding.
Yes.
And some of that animosity that you're talking about, it's interesting. There's almost a little bit of a secret underlying war between breast cancer and ovarian cancer survivors, noting that survivorship in cancer means 5 years
Right.
cancer-free without
Okay.
recurrence.
All right.
After that, really, we don't track. It's looked at a 5-year period of time. But the reason why is because there's all of these women who are diagnosed with breast cancer and reach that 5-year survivorship because generally there's a lot of forms of breast cancer that are not nearly as terminal or deadly.
Okay.
And so there's this huge group of women who are breast cancer survivors, and they get all of the research, all of the funding, when relatively it's not as terminal as something like ovarian cancer. And so the ovarian cancer survivors are somewhat bitter, I think, that there's so much less research and funding that goes to them, frankly, just because there's so many fewer survivors around to really advocate for it.
And rah-rah in the media
Exactly.
and so on. Dr. Larry, I want to talk to you about prostate cancer because, well, it's a whole other ballgame. Women, generally speaking, are somewhat more inclined to be open about personal issues. Guys just don't want to talk about anything at all. Prostate cancer, come on. How about those Canucks? And that's the end of that. Thank you very much. What is it with guys and this whole stuff that's just, are we just too tough or too dumb to not want to talk about it?
How about those Canucks? It really is the case. I mean, there's more and more, at least, recognition now and awareness about prostate cancer, and it's coming up much more of that. And it's just partly because, there's the whole breast cancer movement has become there's so much momentum, and there's big momentum for prostate cancer.
And so we've sort of been forced into the awareness by all those women in our lives, and the cancer people recognizing that there is a high prevalence cancer among Canadian men. Right. So let's lean on that as a fundraising vehicle, if nothing else, the same way we have so successfully done with women and breast cancer.
Absolutely. There's better testing methods now as well, so that's why prostate cancer is much more much more aware, we have more awareness. But there's some problems with that as well.
Okay.
With men, the majority of men will, at a certain age, over 40, 45, will have something called BPH, or benign prostatic hypertrophy, which is a swelling in the prostate. And a typical thing would be a man has to now have greater urgency. They have to run to the bathroom more to pee.
Okay.
They can't hold their pee as long. They have to get up 3 or 4 times a night time. Those are typical things with BPH. Also goes with BPH is also the fact that you may have erectile function issues as well. And again, that's something men don't talk about at all.
It's not very sexy to talk about.
No, not at all.
The thing about that is that there's a movement towards like BPH and perhaps movement towards prostate cancer as well. So there's that kind of transition stage that occurs with that. Prostate cancer itself is an interesting one, because when men hear prostate cancer, now they're scared because of all the hype.
Sure.
And when they're given a diagnosis of prostate cancer, the options seem small. Number one is you can get a chemical castration. That's one treatment. You can get surgery if it's possible. And sometimes you can get radiation treatments for it as well. So the options are pretty severe in many ways. The crazy thing about that is that really, in reality, many of the cases of prostate cancer, men may actually live with this cancer for years and never ever actually die from prostate cancer.
They would die from something else before they would die from prostate cancer, and the prostate cancer would just be something that they found out that they had as well, sort of on an autopsy, but it wouldn't be the cause of death.
So part of that hype has made it almost we're overreacting somewhat as well. Not to say that's not a problem, but really many men now, you get early detection of prostate cancer, and sometimes that early detection is really good for certain cases, but often it's really a product of the fact that the early detection creates more interventions that's probably unnecessary. And so it creates men with other issues. When you have surgery for prostate, thinking that you might die if you didn't have the surgery, and you won't, is the fact that you may have leakage issues or bathroom issues now. You have to wear a diaper. You may have erectile dysfunction if you hadn't had before. So all those things occur that really change a person's quality of life. And that is really an important factor that we need to look at. So identifying it to a point of early detection is important, but also managing it properly, getting all the information, knowing exactly what kind of cancer you have, and treating it in other ways before you have to slash, burn, or cut is an important factor.
And this isn't something that's unique to sort of a naturopathic perspective. This has also been a shift in the medical perspective, sort of conventional medical perspective, because we used to historically do something, a test called PSA, prostate-specific antigen, and that was a really common test and would be like, measure that, see where the PSA is, see how it's trending in men. And now a lot of doctors and a lot of the major sort of, powers that be that make a lot of medical recommendations have said, stop testing the PSA all the time. It's not an appropriate marker. It causes too many early interventions. Because anytime you look for a test, you need to look at what that test is going to do for you. Is it going to change your management?
Sure.
And then if it changes your management, is that a good thing? Because we don't want to do any sort of intervention, that, especially those that could be risky, unless there's a clear benefit.
Right.
And that really has changed the sort of perspective on that conventionally as well. So there's been a lot of hype about prostate cancer. And like we said, the awareness piece is good, but really looking at what that ends up meaning as far as intervention is really important.
Well, the take-home message from both the breast cancer and prostate cancer campaigns to the typical Canadian is, if you're a woman, have one of those breast exams, a mammogram every year, and if you're a guy, have one of those tests when you have your annual checkup. The doc's going to run you through a bunch of tests and throw that one into the mix. Neither one of those take-home messages are anything but good, I would think, right?
Not necessarily. I mean, that's the thing. There's definitely value in appropriate breast screening for whether that's ultrasound or mammography, but definitely some of the ways, especially with something like the PSA, it's really changed.
Okay.
And the same with rethinking the PSA test and the true value of that, and maybe the early detection is too many interventional treatments that are necessary. It's mammography, same thing. They're rethinking mammography in many ways as well with breast cancer screening, is because there's a lot of issues with early detection, early intervention, and doing surgical procedures to the breast that create problems and trauma to the patient emotionally and psychologically, as well as physically. that can create future problems as well.
It's almost like, it seems like information-wise, it'd be a great idea for us to get a full-body MRI, every year.
Right.
But you go looking for something, you're going to find something.
Yeah, I guess.
And then really, do you want to then be responsible for having to go get everything that's seen biopsied? And a lot of things are self-resolving.
Sure, sure.
And they would dissipate.
Not that it's a contest at all by any means, but which of the two, breast cancer or prostate cancer, is more deadly? Which kills more Canadians, the women's ailment or the guys?
Breast cancer, for sure.
Is that right?
Yes.
Yeah.
Okay. And are the numbers still significant, Alex, on an annual basis?
Definitely, yes.
Okay.
I think 20 years ago, it was 1 out of 11 women in Canada or North America would have a risk of breast cancer. Now it's 1 out of 7, I think.
Wow.
Yeah.
Again, so the numbers are just, despite all the research, all the enthusiasm, and all of the money, we seem to be losing ground as time goes on. It's so weird. It's because, especially again with the enthusiasm, you're led to believe through that enthusiasm that we're really gaining ground here. We're just a half step away from knocking this thing out of the park.
And that's where exactly looking at the multifactorial aspect of environment interaction with it is so important, because we talked about heavy metals earlier.
Yeah.
And mercury toxicity. Well, mercury can definitely affect breast tissue. Because it's very xenoestrogenic. And just like pesticides, and also we talked about antibiotics in meats.
Sure.
Growth hormones, yeah.
Yeah, and growth hormones, they're all tied into estrogen-like compounds. And they affect breast cancer. They can affect breast tissue significantly and creating degeneration, but they can also affect prostate tissue as well. So many men with benign prostatic hypertrophy or swollen prostates, and perhaps cancer, may have had too much exposure to estrogens as well.
Interesting.
Through the environment, through meats, whatever else. And same with breast cancer.
And the same thing, like we spoke about, a lot of these women and men who have diagnoses or have kind of gone through treatment for either breast or prostate cancer and now are in that survivorship, a lot of what I think the rest of the conversation that we're going to have today is going to be about is, so what now? If I've been told, it looks like I'm cancer-free at this point, where do we go from here?
Right, and that's what I was, and thank you for opening that door, Alex, because you mentioned, Dr. Larry, at the beginning of our conversation that one of the ailments that you, in the old Integrative and the new name Integrative, have dealt with for many years is cancer patients. So tell us a little bit about what happens to when a cancer patient comes to the Integrative Naturopathic Medical Center. Obviously, there's been a diagnosis, and in many cases, it's a person who's probably walking on pretty shaky knees, just trying to get some more information. So how would you handle someone who has just been diagnosed with cancer and who wants either a second opinion or a little backup, please? What do you do?
Well, you get a patient coming in with a diagnosis, that's a firm diagnosis. First of all, we're really happy that they've had the diagnosis and they have allopathic or medical care at that point, because you want to have all that information from the medical system to provide direction. What we need to do with the patient is find out exactly what their current status is, what their lifestyle is, what their current health status is their immune system strong? Do they have secondary illnesses that we need to look after? What is their status of their overall health picture as an individual, not just as a cancer?
Right, because maybe they'll have another chronic condition and they're taking meds for that, and that's piling on.
Exactly.
Sure, yeah.
And so we need to look at that person from that whole perspective. And so we'll do a lot of diagnostics and tests around finding that piece of the puzzle. Therefore, we can then bring that equation back with the diagnosis they have of the cancer itself. And from there, we can work with the patient with mental, emotional support. We can have counseling that can help them. We have things like to help them with mitigating treatment that they get from side effects of cancer therapies that can occur. But at the same time, we also want to help them with integrative diet. It's their diet.
I was just going to say that. If you're diagnosed with cancer, you're going to be taking some kind of therapy for it, and you're absolutely going to have to modify your diet in some ways, Alex. So, and you just happen to have nutritionists on staff.
We do, and this is unfortunately one of the, I would say, common cancer myths, that it doesn't matter what a patient eats. And I would argue the fact that it doesn't matter what how can you say that it doesn't matter what someone eats, let alone cancer patient or not cancer patient?
Sure.
Of course it matters what you eat. This is the nutrition, the things that fuel us and are our building blocks.
Sure.
And so, yes, we've got a specific sort of protocol, and our nutritionist is very skilled with working with cancer patients because it's multifactorial. You obviously want to do things that don't feed or aggravate the cancer.
Right, of course.
But at the same time, so there is some limitations and restrictions with what you want the person to eat.
For sure.
But at the same time, you really want to be able to help have them eat something, because weight loss is a huge problem with a lot of people undergoing things like chemotherapy, when you have the nausea and the vomiting and all of that. And so being able to find things that they're able to tolerate is also a huge problem.
Sure.
So looking at the things that we can get into their diet that also will be anti-cancer and will help fight the cancer is also really important. So all of those things are ways that also the patient can start feeling like they're in control, because they can make some choices in their own home, and their other caregivers and family members can really make choices that'll help that person and help fight that cancer.
Right. We need to take a quick break here, and we'll talk more about this and individual approaches, because you're right. You get diagnosed, and your world just melts away. All of a sudden, your life is changed in a matter of seconds. And then you have to try and take charge again. As Alex was just describing, well, there are professionals who are right there to help you gain control. And they happen to be on West Broadway in Vancouver at the Integrative Naturopathic Medical Center. Our guests in studio from Integrative, Doctors Larry and Alex Chan. And we're back with more on Boomer Life right after this.
It's all about the baby boomer lifestyle. Boomer Life on AM 650.